Hello, everyone, and thank you for being here today. My name is Kiana Tavares, and I am an MPH candidate at Johnson & Wales University. Today, I will be walking through Rhode Island's dental workforce challenges, and more importantly, the solutions we can use to move forward together. Our focus is on building a workforce that is diverse, resilient, and able to meet the needs of all Rhode Islanders. And with the help of the Rhode Island Oral Health Coalition, alongside of our community partners, we will be able to carry out this goal. Let's begin. Let us start by grounding ourselves in who Rhode Island is today. We are a state of about 1.1 million residents, and nearly 1 in 5 identifies as Hispanic or Latino, which is one of the largest and fastest growing communities here in Rhode Island. But when we compare that to the dental workforce, the picture doesn't quite match. Only about 5 to 6% of dentists identify as Hispanic or Latino, and only about 1% identify as Black, while more than 6% of our population does. We also have an aging workforce. More than half of Rhode Island dentists are age 50 or older, and the share over 60 has grown rapidly. At the same time, about one-third of Rhode Islanders are enrolled in Medicaid. All of this tells us that we need a dental workforce that is accessible, culturally responsive, and aligned with the needs of the communities that it serves. When we talk about access barriers, Medicaid and Medicare play a major role. Medicaid covers children, pregnant individuals, people with disabilities, and low income adults. But not all dental providers accept Medicaid, which leads to long wait times and limited availability, especially in high need areas. On the Medicare side, most older adults simply don't have dental coverage unless they purchase supplemental insurance, which many cannot afford. As Rhode Islanders' older adult population continues to grow, this becomes a more urgent access issue. Understanding how many Rhode Islanders rely on these systems helps us target solutions where they matter most. Patients report greater trust, better communication, and higher satisfaction when their provider shares their language, culture, or lived experience. Diverse teams also expand access to Medicaid in underserved communities, where we're strengthening patient provider relationships and improving adherence to treatment plans. So, this isn't just about representation, it's about delivering equitable, effective care. Rhode Island has already begun taking meaningful steps to strengthen its dental workforce. Policy efforts include expanding Medicaid adult dental coverage, creating loan repayment pathways, and integrating oral health into statewide workforce planning. Educational partners like CCRI and local universities train dental hygienists and assistants, while community organizations, including community health workers and health equity zones, provide mentorship, exposure, and early career support. These programs are promising, but they need sustained investment and coordination to truly grow. When we look at our neighbor Massachusetts, a few things stand out. Massachusetts benefits from larger training pipelines, strong financial incentives, and well established partnerships between education, state agencies, and community clinics. These coordinated systems help them maintain a more stable workforce. Rhode Island can adapt and even improve upon many of these models to create a more resilient, long term dental workforce strategy. This slide shows the full dental workforce pipeline, from early exposure all the way through long term retention. We start with outreach to high school and community college students, especially those from underrepresented groups. From there, mentorship, academic support, and clear pathways help students move into dental and allied health programs. Incentives, such as scholarships and loan repayment, attract trainees to Rhode Island and encourage service in high need areas. Hands on experience in community clinics helps students build skills and connections. Finally, retention is just essential. Even the best pipeline fails if providers leave. Retention requires fair reimbursement, professional development, and strong early career mentorship. When all of these components work together, we build a pipeline that is sustainable and coordinated, not fragmented. As we close, the message is simple, quite simple actually. Rhode Island has a real opportunity. We can build a dental workforce that truly reflects the communities it serves, but only if we invest now in long term pipelines, if we support diverse trainees, and create retention systems that allow providers to stay and to continue to grow. Together, we can build a workforce that is equitable, resilient, and prepared for the future. For those who want to continue learning, here are a few excellent oral health and workforce focused podcasts. Dental Soundbites. This is the ADA's podcast with episodes on workforce trends and DEI. Beyond the Profi podcast, centered on minority women's leadership and voices in oral health. These resources help keep the conversation going and highlight diverse perspectives in the field. There are several organizations and newsletters that provide ongoing updates, data, and opportunities to engage. The National Dental Association, the Hispanic Dental Association, the Society of American Indian Dentists, and for regular updates, I recommend the HRSA Health Workforce Updates and the Rhode Island Oral Health Coalition Monthly Brief. These resources help us stay connected to national and local workforce developments. Now, as we wrap up, I want to acknowledge the partners, providers, students, and advocates who make all this work possible. Your efforts are essential to moving Rhode Island toward a greater future. Thank you all for your time, your partnership, and your commitment to improving oral health for every Rhode Islander.